We are super excited about this particular topic and to share this important information with you all. This is an important topic because we know that every good organization that's doing work out there needs gas in the tank, right? We need to be funding the operations to make sure that we're able to keep doing the great work that you are. Really, really pleased to have three leaders in this. First, I'll introduce myself. My name is Bill Wolf, policy at Safe House Project and principal at the Wolf Group. And of our Freedom Requires Action webinar series, we a monthly webinar around certain issues related to where do we need to kind of move in the right direction? Where do we need the movement to be able to fully be effective in efforts to eradicate human trafficking? And this month, we're talking about the barriers to accessing government in the support of anti-trafficking efforts. So, like I mentioned, we have incredible presenters with us today that are really going to understand what are some of the funding streams that are out there. What does federal funding really mean? It's really the gold standard that we should be shooting. What are some of the barriers to funding that exist right now in our space as well? So I'm going to start with Darlene Hutchinson. Darlene's a dear friend and the former director at the Victims of Crime at the U.S. Department of Justice. And really, for those of you that don't know, the U.S. Department is at the highest level of federal funding when it comes to domestic anti-trafficking efforts. And so this is something that is really, really important for us to understand how some of these funding decisions are made and what the priorities really are. Darlene has more than 25 years in victim advocacy, has played an active role in passing legislation, advancing public policy, teaching at police academies, and working directly with victims of crime. Upon receiving a presidential appointment, Darlene was sworn in as the director for the Office of Victims of Crime at the U.S. Department of Justice. And in this role, she was responsible for nearly $8 billion in grant funding to combat human trafficking and support victim compensation and assistance programs and providing essential services and enhancing victim rights. Prior to joining OVC, Darlene volunteered for 10 years at rape crisis centers in Alabama and Texas and served for 7 years as president of the victim support and advocacy groups, accompanying hundreds of survivors and families to parole hearings and trials. Simultaneously, she's worked 20 plus years in publishing and communications, including 8 years as the editor of law enforcement publications in Alabama, Washington, D.C., and Texas. I mean, Darlene, you have such a wide history and just in this space and working in this space, and have really been a true champion of the work that's going. But I was wondering, as the former director at OVC, which, as we mentioned, oversees a substantial portion of that federal funding, could you share some of your insights on the most significant barriers that organizations face when accessing some of these funds? And from your experience, how some of these obstacles can be addressed through policy reform to streamline the process?
Thank you so much, Bill. I appreciate the invitation to be with you and your participants today, and appreciate the great work that you guys are doing every day to help victims of crime, particularly human trafficking victims, and to eradicate human trafficking. The federal funding system is complex. I think everybody on here probably could agree with that. There's not a lot of things that people agree on these days, but I think everybody would concur that it's a very complex process, much more complex than I think it should be. I know when I first got to DOJ, I had come from the field, and it baffled me how you really needed 40 pages to write a narrative to explain your project. Sure, we need details. You need good benchmarks, good deliverables, It needs to be clearly outlined what you're going to achieve, and it needs to match up, of course, to what the solicitation is asking for. But I just found that they were much more complex than they really needed to be. So the smaller programs in the field who can't afford a grant writer, their program managers are often doubling as a grant writer, and the internal staff, that they were having to be pulled up away from their victim service duties and the work that they do to write grants that they hope that they would get. And of course, there's a lot of people chasing those dollars. So the federal funding is great, and especially the fact that you can get in on some of the training and technical assistance, possibly if you are one of the grant recipients. But I always encourage people to diversify and look for other funding sources so that you're not too dependent on the federal money. But more than anything, to address the federal side, I think we've got to constantly be looking for any redundancies and any overlap between programs. There's a number of federal agencies that are funding human trafficking programs, and we want to make sure that we're always using that funding as efficiently and effectively as possible, so that we're reaching as many survivors and affecting and helping as many lives as possible. And I'd be happy to elaborate on any part of the federal side of that or the diversifying. I think that some of the states these days are more open, and because of the peculiar economy we're in, may have some of the funding that can augment what programs need. So state legislatures may be an option of where to go simultaneous while you're applying for that federal grant or in lieu of.
Darlene, really quickly before we move on, you mentioned something. You mentioned TTA in your comments, and some of the people that are joining us today may not know what that means or how that is really applicable to them. Do you mind talking a little bit about TTA and what OVC and HHS offers in that regard?
Sure, and of course things have evolved a little bit since since you and I were at DOJ, and so I'm not completely familiar with. I mean, some of the programs we had there have continued, but they often will put out a solicitation, or sometimes it's done through a contract, where the federal agency, whether it's OVC or HHS, OVW possibly, will ask for a program. Sometimes it's a nonprofit. Typically, I think it's a nonprofit that has particular and unique training and helping get programs build capacity and help them serve their communities better. And they can share best practices between programs. They can sometimes send staff to you that would not cost the program any money because they're being funded by the federal agency, but and they can train your staff and give you tips on whether it's doing more awareness and education in your community, building a task force, whatever the TTA, the Training and Technical Assistance Project specifically covers. Sometimes it's geared toward minors or adolescents or labor trafficking or sex trafficking, but they can often be a great tool, and they're available to grantees, but sometimes, and we've opened it up more, where it's not just grantees of the federal government that have access to some of those programs.
Awesome. Thank you. Yeah, I know it's, sometimes people don't realize there are ways to start engaging the federal government even before you're a grantee, right? There's resources and services out there, trainings and other things to help get them what I like to call grant ready, because I don't think people understand how rigorous the requirements are for a federal grant. And because of those rigorous requirements, I think it's something that the private sector oftentimes looks at, right? Are they eligible to apply for federal grants? Have they managed federal grants? And so I want to shift to Liam. Liam McCormick is a senior strategist with UBS Family Advisory and Philanthropy Services America. Liam works with families, helping them understand their relationship with money, values, and philanthropic intent. And their focus is placed on the intersection of the 5 types of capital: human, intellectual, social, foundational, and financial. Family Advisory and Philanthropy Services is a thought partner to financial advisors and exceptional client families, supporting wealth transition, family governance, and philanthropy as families seek guidance in developing cohesive strategies to bridge generations and build legacy. Liam, you've been a great partner and friend and colleague in the anti-human trafficking space, really helping to help us better understand the intersection between the public sector and the private sector when it comes to investment in the anti-human trafficking space. And given your experience, particularly with high impact donors and private investment, why do you believe that public-private partnerships are crucial in the fight to eradicate human trafficking? And how can these partnerships really enhance the overall impact of federal funding? Where does federal funding fit into your scheme of investing in this space?
Thanks, Bill. Thanks for the opportunity to speak to your community, and it's always a pleasure, meeting you and all the people you curate to be here. I guess to answer your question, I was intrigued to hear what Darlene was sharing there, because I think many of the challenges with private foundations and private money are similar. Some of the barriers around, there's a lot of complexity about requirements of what you have to do, the application process, and just finding out information where, how do you find these foundations and the family supporting it. And a couple of, I think, to start off, just give some context to the family, the private foundation space, is that we know that it's growing. And the Giving USA report this year said it grew by 15.4% in terms of the number of foundations, the amount of capital flowing in there. So it's it's an $80 billion pool of money that's there, and that is growing, and we are seeing that sort of beginning to accelerate. There's a transition, you probably all hear about it, to a transition of wealth from the silent generation, the baby boomer generation coming down. And a lot of people are using that. So it's flowing into foundations. So with the private foundations, one of the challenges is that a lot of families, when they're coming to this, they don't know how to select organizations. They don't know, how to start doing this. And I guess on a bigger scale is looking at the foundations and the complexity of foundations. You mentioned there are people operating all across the spectrum, from systems change all the way down to small local organizations giving sort of sustenance grants to keep people going. An example of how I think it works really well with both public and private money was, we run a collective in California about in 2019. And it was primarily private foundations, private monies. It was sparked by good data. Some really good information came out saying what the issue was in San Diego. And then a number of foundations, none of them had the capacity to really move the needle on their own. But together, they put together a pool of funds, a collective pool of funds, and started doing an intervention program. We gather the data, and by gathering the data, we're able then to go to federal funding. We got federal, then when the project finished, the federal funding stepped in to continue the program. And I think that's where private foundations, private money is a really good stepping stone into the those bigger pools of money, particularly where if you're relatively new or don't have the data, you haven't got the data to support your model. We can, private foundations are really, and they like that. They like, to be able to be the catalyst or the accelerant where they, open the doors to more money.
It's really a solid point because, because of those stringent restrictions and challenges around building data, I think that's, you raise an interesting point, and that is that a lot of organizations don't realize that they need to be collecting that type of data early on, right? To be eligible for some of these federal grant programs or to prove what they're actually doing. In fact, I remember working with several different organizations, and, you kind of get into the the different categories of federal funding. And sometimes they'll say, well, this is for new organizations. And people are like, well, I've been around for 10 years. I'm not a new organization. And say, yeah, but you don't have the data that they're looking for in these kind of upper tier levels of funding within the federal government. And I think, in application, right, this is something that really impacts those on the ground. And so I'm really happy to have Brittany Higgs with us here today. She's the founder and CEO of Her Campaign. She's a dedicated advocate of her nonprofit, which is based in Billings, Montana, but they serve survivors from all over the country and have truly one of the best models for residential care that we've seen. Her journey in the anti-human trafficking movement began in 2015 when she embarked on several impactful trips overseas, working closely with NGOs in war-torn regions, and she witnessed the harrowing realities faced by survivors and just really felt a calling to make a difference. And she truly is doing that today, making a difference here in the United States. Prior to dedicating her life to the cause, Brittany's had a successful career in the film and marketing industry. Her entrepreneurial spirit led her to start multiple businesses where she honed her skills in strategy, creativity, and leadership. This background uniquely positions her today to approach the challenges of running a nonprofit organization, which I don't want to speak for you, Brittany, but I imagine running a nonprofit is probably the most challenging of all of those entrepreneurial endeavors. It truly is. And so really getting to that ground level piece of it, as the founder of the Her Campaign, you're deeply involved in providing direct support to survivors of human trafficking. Can you talk a little bit about some of the biggest challenges you faced in securing adequate funding to sustain that programming? And how do these challenges impact your ability to provide comprehensive care to survivors and to meet the need or the demand for those services right now in the field?
Yeah. Well, thanks, Bill. It's good to be with you guys. And Darlene and Liam, it is an honor to get to speak with you both. The work that you do is phenomenal. Liam, you're obviously like preaching something super significant because you're setting the building on fire. And so I'm here for it. This is amazing. Yeah, I think, all of the service providers on this call, organizations that are represented here, I think I'm just going to be preaching to the choir that funding is extremely difficult, and we've got to get creative about sustainable funding sources to really keep our programs going for the long haul. This has been something that it's feast or famine, really. You guys are talking about federal funding. We have not gotten federal funding. Bill has actually been an incredible sounding board where we'll call and be like, okay, Bill, like, are we prepped? Are we ready? Are we at a position where this is weighing the pros and cons? This is actually going to be beneficial for our organization at this time. And really, because of some of your points of, Darlene, there's not enough people and resources for the grant writing process and for oversight and reporting. You really need a full-time person that's on your team that's just going to be focusing on that. And we just haven't had that yet. And so that's something that we constantly are like, okay, is it time to tap in? Nope, not yet. I think some of the barriers that we face is the anti-human trafficking movement, especially in Montana. Montana is kind of 20 years behind everybody else, it feels like at times. And Billings is a small community. It's the largest city in Montana, but we've got 120,000 people. So when you're thinking about foundation, private funding, state resources, it's going to organizations that have high numbers of clients coming in, right? And we know with the complex trauma that the survivors we serve, the level of care needed to really help them get into long-term programming and through that continuum of care is significant. In trying to redefine mindsets of, we're not trying to build a program and resources that are a revolving door, but we need significant time, energy, focus on these women, these survivors who are coming in with these intense, complex issues. I just know for us, we've hit barrier over and over and over again with funding because of that just not knowing how much it actually takes to come alongside of these survivors and get them it, from recovery to economic independence. We would get grants at the beginning, but then as we're going along and you're only serving 30 to 40 clients a year, but you're seeing a 75% success rate of them graduating, emergency shelter program is what we saw, and stepping into that long-term care, there's still just not that shift of like, this is what actually we need to move forward. So I don't know. We've just hit barrier and barrier after barrier when it comes to funding. And at a state level too, I think for us, we focus on that emergency stabilization piece, which is that first 90 days. And, DPHHS has funding, they have sources, there's low-hanging fruit with different services that our survivors can tap into. But because we're also serving survivors from other states, a lot of times those services come through Medicare or Medicaid. And a lot of times it's just not applicable right at that beginning first 90-day stage. And so we just hit barriers even with some of the resources that we can use that are available in our state. So those are some of the things that we're seeing.
No, I really appreciate that. I hope you all will forgive me. I'm going to go a little off script, and Liam, I'm going to ask you if you can maybe respond to something that Brittany touched on. I think it is important that we educate donors. I think that it's important for not just government funding entities, but those in the private sector. I wonder if you have some recommendations or thoughts on how advocates or those in the anti-human trafficking space can be doing a better job of educating private foundations, philanthropists to truly understand what's required in this space and what real impact looks like.
That's a hard question. I think one of the challenges we have is that when we see something in the media, which is human trafficking relating, we all jump on it and post it and get out there. We see movies coming out about rescuing children from overseas countries, and I think it forms in a lot of people's minds that this, despite all that what we know, this is something that is really affected somewhere else. It's something happening to other people's children, and it's happening to children that don't look like me. One of the things that we found successful in our San Diego project, the awareness raising was because an in-depth report was done by a foundation there that basically said, hey, this is happening in San Diego. 80% of the kids trafficked in San Diego are from San Diego. And guess what? I can't remember the exact number, but it's like 90% of the high schools in San Diego have had incidents of trafficking. And what that did was it made it personal, and it made it very, very local. And so one of the issues I think we always have in here is it's something that happens somewhere else. It happens to kids who are from, poor backgrounds or whatever it is. It's not something that happens to my children, and they don't. So I feel that good evidence around that part of it, not just how we're rescuing people and how our programs, but saying this isn't something that's happening somewhere else. It's happening in your backyard. And actually, when you look at the data, particularly online, the predatory behavior that's on there, I think I saw something about 60% of children who are using, roadblocks are approached within a certain time frame. It's alarming. It's a lack of understanding. And so the idea that's going on somewhere. So that's one of the first things I would say, is trying to raise that awareness somehow, that and show that it isn't just something that happens somewhere else. I think promoting case studies where of success, more and more people getting. I know there was a conference in DC recently where people getting together, sharing information. But often what I find is that when you go to some of these conferences, is a lot of people like us who know what's going on. It's not the donors, it's not the foundations, and trying to find a space where the foundations and those people can always come and be educated as well as the professionals. And it's a bit of a feeding frenzy at times when people do come in, because everyone's sort of sharing the information. But having something which is not owned by any particular organization. This is the issue. This is what we need to do. And this is what's happening in your area, almost mapping the needs in people's areas and giving foundations a way to respond to local things. Because most of the organizations, most of the families I work with want to start at home. And the reality is it's local, it's national. They walk past, homelessness, they see it locally. So they want to do that. But they're not always equipped with the knowledge they need to make informed decisions. So I think that's one thing. Am I rambling? Is there anything else, Bill, you particularly you're thinking about?
No, I think that's spot on. I think that, what I hear is just a call for, sometimes people worry that their public education efforts are not working, right? But I think there's multiple, reasons to be doing those. And certainly I hear, your comments, the movies and other things that come out can be helpful in sparking the conversation, but sometimes they paint a picture that's not exactly accurate of what's happening in our own backyards. I think there's also sort of this misnomer or this misperception that people only want to fund what's happening overseas. I don't think I agree with you, Liam. I think they do want to be helping in their own backyard. I think we just have to be communicating that and educating those that are in a position to fund and to prioritize, and that kind of takes. Oh, go ahead. Yeah.
No, you've sparked a thought. I mean, one of the things I often find when I work with clients, their first port of call is, we want to do something in human trafficking. We want to set up a safe house. We want to do something. And I go, and sometimes I have to say that, let's stop. What's already going on in your area and sort of who's already out there? Let's look at because there may not be a need for that, but there may be a need for something else, and actually helping them understand that you don't have to own this. There are ways. There's already people out there doing good stuff, and perhaps helping someone scale what they're already doing might be a better approach than trying to own that. So, and I think that there's sometimes if we as organizations, when we're coming together, I think humility is quite hard because we're all, I love what Brittany was saying in terms of this challenge for money is that if we can root for our rivals, as someone says, if we can make sure we're really trying to serve people who have been caught in human trafficking, and is there a way we can come together and sort of share knowledge, share networks, share donors, share and be this more collective. But because of the state of financing, we often are very we think our method is the only way that works, and so when are people coming into it, I think they'd be more open if there was a sort of most people come what they want to learn and find a way of learning without necessarily having to commit to a dollar amount.
Well, I just want to,
Bill,
so,
I can add in,
yeah.
I'm sorry. Go ahead.
Oh no, sorry, no, it was just choppy. And actually, I'm going to come to you, Darlene, because I do want your comments on this. I just wanted to share very quickly, Leon. I have to give you, credit where credit is due. You have been championing this effort of collective impact, particularly when it comes to funding. I think that study that you referenced was a real kickoff point for that. But I want everyone to know that there are people that think broader, and Liam is definitely one of those that has really been pushing to change our thought process when it comes to funding, particularly in the private sector. And so I just want to thank you for your work in that and your commitment to it, because I know sometimes it's like trying to turn a cargo ship around, right? It doesn't happen very quickly. But Darlene, now I want to go to you because I want to get your perspective on this, and in particular, drawing some of those parallels between what Liam was talking about in private philanthropy, federal dollars, but also the state, right? You've done a lot of work at the state level as well. And I'm curious as to your perspective on the diversification at the state level.
Yeah, and so much of what Liam was saying is directly applicable to how you would communicate with state legislators. And Brittany's point too about having a large state that it is, whether you're in a big state or small state, and whatever your population distribution is, your state legislators represent that entire state. Everybody is their constituents, by however the districts are drawn. And so you can find some sympathetic ears. And tell them about what's going on in their backyard. And Liam brought up case studies. That's one of my favorite things too, that you can, and even if they're somewhat hypothetical, I mean, we of course want to protect privacy, but there are ways that you can tell about an example of a victim that you're helping on, and make it 2 or 3 varieties that because you do want to have a good, compelling document, a communications tool that you're giving to, whether it's your state legislator or somebody in the governor's office or a private donor that you might be communicating with. It's quite different than the federal system, of course, of applying for those complex grants, but compiling the data that you have, and it's not reinventing the wheel. A lot of this you may already have on your website, and you're just extracting different parts and constantly thinking about who my audience is. Am I going to hand this document to a state legislator or a private donor? And you may have somebody with a communications background that's in your neighborhood or your church or a family member or on your board of directors that will help fine tune that to make sure that it's clear, because we don't want the typical, we all talk a different language. Everybody on this a call can talk about, there's jargon and terms that we can use that we all understand each other, but you have to understand that who you're talking to may be starting at zero, because, and I think Brittany was pointing this out too, they just don't realize some of this is going on and what it looks like in their backyard, and whether it's exploitation, if it's juveniles, if it's labor trafficking, just what's happening in your community, what is the need. One of my big successes in the last couple of years, after I left DOJ, the governor in Alabama appointed me to the Alabama Crime Victims Compensation Commission, which I had known this state agency for decades. And I applied to them in 1988 when I was a crime victim. And so I knew the program very well. But when I came in as a commissioner and saw the funding crisis that we were in, and we'd never been funded by state general fund dollars, well, that needed to change. And so I grabbed all the data I could, went back through annual reports, and took a compelling case to the legislature. And we got $2.5 million in general fund in the first year that we attempted it. But we just had to tell them what the need was. Who is it that we're paying? And just the very top level, because they're being hit with so many topics and so many subjects that you want to give them enough information that they understand your world and what you're trying to solve, but yet they want to be part of the solution. Quite often they brag now that they've helped us, but they want to see the results of it too. So within the first year, we got $1 million from the governor's emergency fund, and we had a backlog of cases, 2,000 cases that were backlogged, and we are more than 2/3 of the way through those cases in our first year. I wish we were 100%, but you have to take those success stories to them and tell them what it is that they're funding, and that applies to the private sector or to the state legislature.
And can I just ask you to kind of expand on that a little bit in the realm of, to talk directly about VOCA for a second. So many people don't know that the federal government provides block grants, so essentially a chunk of money, I'm oversimplifying, to states that they can then use for programs to serve victims of crime. And they're very broad, and the states can set up those priorities. I know a lot of organizations have been frustrated that their states have not prioritized human trafficking in particular under their VOCA programs, that the majority of that funding still remains with domestic violence programs, which of course we know we need to be investing in. But I wonder if you could take a little spin on that and talk about the importance of advocacy at the state level. Why is it important? So you were talking about how we were kind of moving the needle, right, in some of the work that you were doing. Do people's voices really matter when it comes to state government decisions and even federal government decisions?
They absolutely do. A lot of people are hearing about the crisis that is going on with state VOCA dollars, and it is truly a crisis, but I don't say that to discourage anybody on this call from pursuing those dollars. Each state, as you mentioned, does get two formula grants. One is for crime victims compensation. Some states call it reparations or have other terms. And that's calculated a completely different way. And that's mostly reimbursements to crime victims for funerals, medical expenses, which we're trying to open that up more and more for trafficking victims here in Alabama. And some states have been looking to do that, to actually reimburse victims of crime. And there's a lot of nuances and requirements for that. But the bigger chunk of funding is the state VOCA assistance dollars. That's the word to look for. There's assistance and there's compensation. The assistance dollars is based completely on your population. And there are some parameters that there's one state agency in every state that the governor determines who that is. Some are through the Attorney General's office, some are independent agencies, and they determine who gets their subgrants. You can meet with those and find out who your SAA is, what they call it's a state administering agency. Find out who that is in your state. You can go to the OVC website and find that information. Probably Google or on the OVC site, look for state VOCA, Victims of Crime Act is what that stands for. And I would research and find out who the person is that's making those decisions. Go meet with them. Take these documents that I'm talking about, whatever you've compiled that is compelling, that explains what your program does, the success stories you've had, who your partners are, if you have MOUs in place, or if it's a task force where you're working closely with law enforcement. And do keep in mind that a lot of your state representatives, depending the breakdown of your state, every state's a little different, they're often looking for success stories on the prosecution and enforcement side too. So if you do have relationships with law enforcement, because they want to know that the cycle of violence won't be repeated, and that works for some programs that correlates with, and others it may not. But tell them what you're doing, what your successes are, who your partners are, and even I would use some leverage and get to know people in your governor's office, your attorney general's office, who might be able to persuade the decision makers in that state office that's deciding where those funds go, because it should be more distributed. It should be helping a variety of sexual assault, domestic violence, human trafficking, homicide. The children advocacy centers get a fair amount of that. We are working on a national level trying to help the health of that fund, but money is still flowing every year to those state agencies. So I would definitely pursue it.
Yeah, no, I think it's something that people don't. And I will also say, and I'll be the one to say this so none of you have to, that sometimes the VOCA agencies at the state level will blame the federal government, say, oh, well, they told me. Nope, they didn't tell you how to do it. So if your state is telling you they're not allowed to fund human trafficking programs, you give me a call and we'll go have a chat with them. But I think, we can probably agree that there are significant challenges with the current funding structures. And I know that there's innovators and leaders that are really looking for alternative solutions to funding. And Brittany, if I can just sing your praises for a second, you're one of those leaders that is being innovative and thinking outside of the box. And one of the things that you have been working on, or concepts, if you will, that you've been working on when it comes to funding, is an idea of a funding follows the survivor model. It has been gaining traction a lot, in part to the work that you've been doing and the advocacy that you've been doing around this concept. And this is, something that potentially is a more effective way to allocate resources based on individual needs of survivors. It also aligns a lot with, we hear a lot of discussion around survivor autonomy and the ability to choose the program that works best for them. So could you talk a little bit about what funding follows the survivor model is, and how you would see this as enhancing both her campaign's ability to deliver services, as well as the benefits to survivors that are seeking services?
Yeah, thanks, Bill. I saw in the comments, Ashley, you and I are on the same wavelength, because it is so important for survivors to have choice in where they're going. And I think this model has actually been done in the UK, where they fund the first, I think it's the 60 to 90 days after a victim of trafficking has been identified. And that funding follows the survivor to the choice of wherever they want to go. And, walking in humility, we build a program that we believe is going to follow those best care practices, but we aren't going to be the right fit for everybody. And that's 100% okay. We just want survivors to get the care that they need, that they're desiring at the point in time that they need it. And so funding follows the survivor. What we've seen happen in the UK is this not only gives survivors choice, but it makes all of the organizations providing care raised to a certain standard, because a survivor isn't going to choose your program unless they know that you're going to provide good service to them. So it honestly raises the bar for all organizations across the board. It also opens the door for shelter programs, DV shelters, places that may have bed capacity for trafficking survivors, but don't have the specialized care yet, to then embed specialized care, and they also raise the standards, right, to provide some more services to trafficking survivors. So I think moving forward, this is probably the most pivotal thing that we can do in the country to help to not only get survivors where they're wanting to go, but to provide sustainability for organizations that are doing fantastic work. I think the difference, if I could change everything with VOCA, it would be focusing less on programs and more on the victims. You can't have both, right? Because if you're wanting to be no barrier and have all of these restrictions for programs who have a way of doing this that have results, right? But you're saying we're victim centered, but here's all the stipulations for your program, nobody wins, because the victim isn't actually receiving what they want. The program's hands are tied to where they're not able to provide what they need, and nobody wins. And then it's not sustainable too, because you're getting, like, I think you mentioned this before we jumped on, Bill, but there's organizations that rely on that VOCA funding, but depending on policy changes and who's in administration, right, we see those policies change and you may lose your funding. And so it just doesn't support anybody. So I think funding follows the survivor is the answer to some of these issues that we're talking about. This is something that we've actually had the privilege to bring to our governor and to our attorney general. Bill, you came and flew into Montana and met with our governor with us to say, I think this is what we need to do. And so we're pitching this to legislators in our state right now. Somebody in the comments said it is so crucial for us to remember that even though we can't lobby for our nonprofit organizations, we do have a voice with the legislators, and we get to advise them on these different policies. And the people actually, I mean, everybody who's providing service care, organizations who are grassroots, you are seeing this day in and day out. If we're not bringing this to the legislators, how do we expect them to actually come alongside of us and to help with these funding things? So I hope that's an encouragement to everybody maybe, I don't know, maybe there's a way to put together a thing for each state where it's just like, this is what funding for follows the survivor looks like. This is something you can give to your legislators, and then see what doors open.
Yeah, I think that it's, again, truly just congratulations for really being able to think outside of the box, like, on this. And I think, one of the pieces to really consider with a model like this is that it takes very limited resources, and it makes sure that we're using them effectively. I can tell you, and again, Darlene, I'll speak for myself and not for you here, but one of the frustrations that I had during my time at the Office for Victims of Crime was large grants, relatively large grants that were being given out. And then when those organizations would report back their impact or the number of service units provided, it was very low. A lot of that funding was really going to overhead, and even though they weren't technically holding beds, it was still somewhat holding beds, right? They were just keeping things alive. And so those were resources that other programs could have been using to serve survivors, because I know, Brittany, you have a waiting list at her campaign. I know there are other programs around the country that are constantly having to, unfortunately, turn survivors away because just not having the resources. I know we're out of time. We've actually run over a little bit, so I want to kind of end with one final question that I want to ask all three of you in 30 seconds or less. If you had a magic wand to wave, what is one thing that you would change about the funding space that you think would make it more effective? And it could be from your perspective, Liam, from your perspective in the private sector, Darlene, more, government sector at state and federal, and then Brittany is a nonprofit. So Liam, if you don't mind, I'm going to start with you.
Okay, yes, no, quickly. Well, my son is just a rising senior at high school at the moment. We're going through loads and loads of college applications, and they have something I've discovered called the Common App. And I thought that would be a great idea. You could do one application and do all of that work, but feeds into multiple foundations. The foundations could have that idea, and addressing the different components of human trafficking, whether in a prevention side, whether they're in prosecution, survivor focus. And so it would just cut down on a huge amount of all those applications people need to do. But that one application, this is who we are, this is our results, what we're doing, and it could go to multiple foundations who want to support that stuff, because I think there's a real disconnect between the two.
Awesome. Thank you, sir. And Darlene?
I'm a big believer in what Liam just said. That's like a light bulb just went off. But I would probably say that if I had a magic wand, I would want for all the great programs that are represented on this call and that are out there in the field to not be as intimidated as many of them are, and to feel like the communications, that they have the communications expertise to collect the data they need and relay that to legislators or private donors, that they have that level of confidence to assemble their information and present what the needs are of the victims that they're serving, whether it's housing, medical, income, food, all the various things that but that you got to present tangible examples of what you're doing and what the need is in your community. If it's labor, if it's juvenile, or the niche that you're serving too, but to have that confidence and take that message to the decision makers.
Thank you. And Brittany?
Yeah, I agree with both of you and everything you said. I think I kind of already answered where I really feel passionate about this funding follows the survivor, and I think it is an answer in the nation. But I want to circle back to what Liam said a little bit ago, and you just talked about humility and championing one another in this movement. And I think with that too comes a heart of collaboration where we really are sticking in our lane. And this is something that we constantly are reevaluating too in our organization of what are we doing that somebody else is actually doing better, and we're stealing resources and funds and people that could actually be given somewhere else into the movement and done really well. And so I think just as a movement, a challenge for all of us is just to continue to work with a heart of collaboration and figuring out how we can come alongside of each other instead of competing for the same resources, just staying in our lanes. That's one of the reasons why I love, Safe House Project, and Bill, you and your team is you guys are so collaboration focused. And so I think we just need more of that. And we're always open to conversations of what that looks like and how we can come alongside of each other to share resources and not create this bottleneck effect when everybody's trying to do the same thing at the same time. So.
Well, I just want to thank all of you for sharing your time. 3 incredible experts and leaders in this space that are thinking outside of the box, willing to take risks to really transform our approach to eradicating human trafficking. So Liam, Brittany, Darlene, thank you so much for your time. Thank you for all the work that all of you do in helping to eradicate human trafficking. Have a great afternoon, everyone.